Am I going to have enough breast volume after my explant? Is a very common question, and rightfully so, because we're going from a larger volume with an implant to a smaller volume of the breast. The answer to that question is that we're going to try to do everything we can with auto-augmentation techniques in order to salvage and save and use as much of the breast tissue as the patient comes with in order to give them that much better, more youthful contour of the breast. In reality, there are several techniques to do that. I think there's certain techniques that apply to certain patients better than others based on where their volume actually is. And being aware of all of them, or at least most of them, allows me the opportunity to really configure my surgery to that patient. One of the techniques is actually taking the bottom of the breast, which can be thinned out sometimes, where we remove the skin from the bottom of the breast and use that tissue and flap it onto the chest and use that as an underlying volume for the rest of the breast to be reconstructed on top of that. So that's one way to do it. Another way to do it is take the outer and the inner pillar and then bring them together, which brings the breast higher and then really bunches it up into a smaller footprint, but therefore more projection. A third technique would be to basically take the tissue underneath the areola, the very central tissue immediately under the areola, remove the skin from that, and flip it underneath the areola in order to project the areola further. You can use all three of those techniques, which is typically what I do in some degree in order to actually try to maximize the result. Ultimately, if that isn't enough, another technique that we can use to add volume that doesn't involve an implant would be fat grafting. The vast majority of my patients don't really need that after the auto-augmentation is completed, but about 20% of the patients do come back, go ahead and fat graft the breast in order to give it the final fullness and symmetry. But bottom line is, I think auto-augmentation is a very powerful maneuver in order to try to use all the breast tissue that we can that's already there and just rearrange it as a three-dimensional puzzle into the best, most optimal contour that we can get.